So, welcome to the Bridge Podcast, the show that connects the clinicians working on the ground to the founders and builders reshaping the system around them. This is for the people done surviving the healthcare system and ready to shape it. Today, I'm talking with Lisa Kubiak, a critical care nurse with over 3 decades at Bedside, who took everything she learned from the ICU and built something of her own. Lisa, thanks for being on the show.
Thank you for having me.
And so, for somebody hearing about Hydrate GA for the first time, how would you describe what you do and who you do it for?
So when I started Hydrate Georgia, it was an IV infusion company that I was doing. I was doing infusions and it evolved into what I have today. We grew from infusions to weight loss to Botox to aesthetics to now peptides and regenerative medicine. And we just pivot and turn to where we need to go to. We're not as heavy in the aesthetics anymore.
Okay. So, you spent 30 years in critical care in the ICU. What did that work actually look like day to day?
So a big chunk of my career I spent in neonatal ICU. So I took care of premature babies and I loved that work. Got burned out on it. Unfortunately, the hospital that I was at, the environment was toxic, and I moved over. I went back to adults and I was working in the OR. I was doing pre-op at one of the large hospitals here in Atlanta. And then COVID came along. COVID did a number on our profession, and I took a chance on myself, and we're approaching 3 years that I've had the business.
So, what made you pivot into doing this specifically?
Okay. So before COVID, I did work for an IV infusion company. I saw how the business worked and I knew I could do it better. I had that on the back burner. And then when I was my last few months in Bedside, it was the hospitals were it was just basically chaos. We were working very short staffed. Our patients were very sick. It was just never ending. We didn't have enough staff. Supplies were coming in and out of stock, and it wasn't enjoyable. I wasn't appreciated, so I took a leap of faith on myself.
And you said the turning point you think was COVID because it was a big shift
It
in what was.
was a big shift. The hospital's focus before COVID was on patient care. The care was much better in the hospitals. Staffing was great. I mean, it mattered to do a good job. After COVID, I mean, we've had travel nurses and they seem to be a cheaper commodity to bring in. So as you were losing staff, you were gaining travel nurses in there, and they were getting paid more than we were, and they didn't know as much, and so we were carrying a lot heavier the burden, but they were just basically a body there helping out. Not to throw any shade at the travel nurses, it was just a whole different time.
Yeah, and they don't have they come from other locations, and I'm sure they learn how to adapt quickly, but there's nothing like full-time staff in a location that know the building, know the way it runs.
The policies, procedures, who to call, who people are, how things work. Yes, that is
Yeah.
absolutely correct.
So Hydrate Georgia started in a resort spa
It did.
before it landed in Athens. How did the versions come together?
So I started off in a 5-star resort here in Georgia. It's in Brazelton, Georgia. I went in there. I was doing IVs for the guests there, if they were having massage or facial. A lot of times they were getting IVs. I had a few people that if they were hungover, it was a vineyard. So if they were hungover, I had treatments to help them feel better. People that were traveling in from out of town, if they got sick with a stomach bug or something. So we would cover all sorts of ailments there, health and wellness, skin, and the resort was having some issues with management, and shortly after I got there, their marketing department left, and because they were a brand I couldn't market myself, so I would go all week with maybe one IV. So I had to make a decision. I was there maybe 4 months. I had to make the decision to leave, or else I was going to lose my business. And I landed here in Athens, Georgia, which is a college town, and my location is close to downtown, and it has just been great ever since I've gotten here.
Okay. What made you plant the roots in Athens?
So both my kids attended the University of Georgia. Go Dogs. So I was familiar with the area. I had a nurse who was working for me where my location that I'm at, she was living in the apartments up above, and she told me about it, and I contacted the owner who was desperately trying to get somebody in to do IVs, and we started there, and I started with one room here, and I'm now at 3.
So moving from a employed nurse to a business owner is a big leap. What caught you off guard about running the whole thing yourself?
So it's I traded one set of problems for another. I don't have to get up to an alarm anymore, which I'm hugely grateful, because we would start our shifts at 5:30 in the OR, and I lived about an hour away. So it was getting up at 3:30 in the morning, which I don't miss anymore. Atlanta traffic, going home at 6 p.m., that would take an hour and a half to go home. So there were definitely perks. Some of the trade-off with running a business, it never stops. You're constantly thinking about it. You wear so many different hats, from the care provider to the scheduler to the ordering to the CPA to the cleaning lady to the front desk answering the phone. Financially, you're constantly trying to reinvest and build your business back up. Marketing, networking, compliance, quality. There's so many things that go into it.
Yeah, a lot of hats. Yeah, like you said. So you're bringing like hospital grade rigor into this space, which I believe is often run by non-medical operators. Is that
So business wise, I mean, in a franchise setup, you have your basic protocols and you hire your staff to do it. When I'm the one who's providing the care, I'm taking care of you as if you're my family member. Not to say that people don't give the same degree. It's just when it's your business riding on the line, you want to make sure everything's done to the best of that client satisfaction. A lot of times I am educating. I do a lot of education. I personally, and for my clients, I will refer them to something that may be helpful to them, a therapy that they're not aware of, a supplement that may work better than what they were taking before. Answering random questions. I mean, I had somebody call me on Sunday, ask me if I could get blood anywhere, that her husband was anemic and they won't transfuse him until he's under 8. And I'm like, no,
not?
no, but there's other ways that he can build up his hematocrit and hemoglobin, and just random things.
Yeah. What's hard about competing in that environment that you're in?
Competing in this environment, I am a registered nurse, so there's other med spas around that are physician driven. They have bigger budgets, they have larger staff. Not so much that it's competition, we do things differently. I have always been a why girl. I'm constantly questioning things, looking for things. How can we make things better? I just come at it from a different angle. My setup is different. We look like we're in a living room here. We're not actually in like a medical clinic type setting. I wanted a quiet, healing environment. A lot of times when people are getting their treatment, they fall asleep in the rooms, and it was just the type of vibe that I was going for.
Yeah, that's cool. And just to clarify, you have a studio and a mobile
I
clinic?
do. I do. I do mobile. The mobile came about by oncology patients. I had oncology clients who after treatment they weren't feeling well. It A lot of times they can only receive plain fluids, but after chemo treatment, that's enough to optimize them because sometimes they're nauseous and can't eat or drink or keep anything down, or just flushing the chemo out of them. That's a big part of where the mobile appointments come from. I also do it just basically for elderly or people that can't come in here.
Yeah. And how large or how many staff do you have?
Right now, I have 4 staff members and I'm ever expanding. That's the other hardest part of owning your business. And I will be 100% honest with you. I created my dream job. I have wonderful clients. I have trouble getting staff, keeping them, or having them work.
Yeah. Hmm. A lot of clients, I think they fall between medically stable and and optimally healthy and complex cases and others. What makes the different clients hard to serve?
I do. I walk a fine line between a medical clinic, urgent care kind of thing to health and wellness. And that is very true. A lot of people think because you do IVs that you're medical, and there's certain situations where an IV, if I give you an IV, it's going to hurt you. We do not do pediatric patients under 14, they are weight based. Nurse practitioners are not pediatricians, their family are they're for adult med. And so to get orders for a pediatric patient is difficult. Chemo patients, oncology patients, and pregnant patients, basically, they can only get plain fluids. There's no study showing that the vitamins are safe for them. So we do just basic hydration for them. And more complex, any clotting disorders, any recent cancers, I need to have a discussion with my medical director. Let me think here. Some people, instead of health and wellness, they're coming for treatment, which isn't. If you have a GI bug or a hangover, things like that, I can help with that. Optimizing your immune system with vitamins. If you have like the flu or something is one thing, but yeah, sometimes I have to turn away people or refer them somewhere else if they need something more complex. Like iron infusions, I get asked about that. That really needs to be done in a more medical setting where you have a crash cart because there's more reactions that can happen.
Hmm. Interesting. So when you think about everything outside the actual patient care, the scheduling, the follow up, the behind the scenes work, where does most of your time disappear?
Good question. So when I'm not providing care, a lot of it is going towards answering emails, ordering supplies, and I do a lot of research. I do a lot of research basically on, the latest and greatest that's out there. Peptides are huge right now, and there's a lot of misinformation about that. Keeping myself educated and compliant is a big part of it. Social media is tough too. A lot of time goes into figuring out social media marketing and things like that.
Yeah. Do you use a lot of background systems to run it?
I don't, and that's where I need to get AI integrated to do some of the basic things, and I'm bringing people on board to help me out with that. Like as a nurse, I don't have the business background and or the tech background now. I just recently had somebody update my website to maximize SEO and to make sure that everything's compliant there. AI's the next step to automate some of the things that I'm doing, such as the emails, the multiple emails, the phone calls, the follow-up, the things like that.
Yeah. What is SEO?
Is optimizing your system so that, you get noticed by Google and that people can find you, that you're actually ranking.
Yeah. Okay. So of all the things, if you had a magic wand, which one would it be to fix?
To fix. Which one would it be? Other than me providing all the care, I think it would be all the emails. I'm pretty connected to the emails, which is how we actually met, was through an email, and I get lots of requests for my time, whether it's a podcast or mentoring another nurse or helping a client out.
Yeah, so a lot of time, do you get your referrals through email?
So a lot of my referrals are either they find me through Google, which is great, or it's word of mouth. If I get a client in, I'll usually get their friends and family. So I like to think that we offer something pretty unique here for Athens. We help people feel better. We help improve your quality of life. And a lot of people are struggling now. They're not feeling good. Dehydration is really underestimated. I think we are all in a state of chronic inflammation where we're just not absorbing water, food, and minerals like we used to. So that's one of the basic things that I help with. When I give you my IV vitamins and minerals, they're vegan, gluten-free, preservative-free, they're therapeutic doses. I'm quickly correcting any deficiencies that you have. So our baseline is feeling pretty crappy, that when you do get IV vitamins, you feel superhuman, and we should actually feel like that all the time. Third thing I see with everybody is gut health. Everybody's struggling with gut health. So people are tired of taking a pill. They're tired of not being heard. And we start at the bottom with the low-bearing fruit, and we work our way up to help people to feel better.
So where do you see Hydrate Georgia in by 2027, 2028?
I would like to think that we've expanded. I have people that are interested in franchising me. Couldn't think of the word. I mean, I'm not advertising, and I average about 60 new clients a month. So I'm like 2 to 3 new clients a day. I've tried going other places, doing little pop-ups and in my medical director's office and things like that. It all goes back to the staff. I can open it, but if I have nobody to work it, that's a problem. So I think where I see myself streamlining a lot of tasks that can be sent to AI, getting support staff in. I am hiring medical assistants that will help lessen my load, and then getting nurses interested in working and training and staying on board.
Yeah, that's cool. What kind of clients do you wish you could have more of?
So I have amazing clients, and I'm really grateful. They're people that are health conscious. They're trying to improve their health. They're looking to all different places. I mean, if you buy supplements, I mean, I bet you have a cupboard full of supplements just like me that you took for a month and didn't notice anything from it. So then you moved on. They're just looking for somebody that will listen to them and suggest something that will help them to actually feel better.
Yeah. Can you walk me through or help me understand, like, from what it looks like from the ground for a client to come in from start to finish?
Okay. So a lot of times people will walk by and ask me questions, or their family will tell them about me and they'll book an appointment. When somebody comes in, I greet them at the door. I have comfortable suites. We sit down. I offer them if they want to use the restroom first or not. I introduce myself. I let them know who I am and what we're going to be doing. I let them know that I'm a registered nurse and not a nurse practitioner. We do telehealth visits with my nurse practitioner. I do it with all my clients. They go over their medical history and their medications to make sure that the treatments they'll be receiving are safe. My nurse practitioner interviews them. I get the orders from them, and then we go ahead and we do the infusion. I have people that have needle phobias. Needle phobias are real. I have a little trick that I use. And I'll share my trick with you.
Yeah.
With a background in neonatal ICU, I use small catheters, and when I start the IV, I talk them through what I'm doing. I put the tourniquet on. I'm going to clean. This is going to be cold and wet. And as it's drying, I'm getting my supplies ready, my Tegaderm ready, my catheter ready. I have an alcohol wipe, and I hand you an alcohol wipe, and I have you look to the opposite direction of where I'm starting the IV, whether it's outside my big window here, or if it's in the hallway. I have you pick a spot, and then we count to 3. I count 1, 2, and I insert the catheter. And when I say 3, we're done. A lot of times people don't even feel it, but when you sniff the alcohol, and that's from my pre-op days, it's going to, if you're going to pass out on me, it's going to keep you from passing out. And also the act of following my command is shifting the focus from your arm where I'm starting your IV to sniffing the actual alcohol wipe.
Interesting. Yeah. Maybe I'll think about that for the future. I almost passed out once when I had blood taken.
Yeah, and that happens, and especially if you're fasting, you haven't eaten, and then it's an uncomfortable environment. I have had people, I've had them where the GI bug was worse than the needle-phobia. Some people actually have to cover up their arm while the infusion's going in, so they don't even see it, and then they don't relax until that actual catheter's out.
So for the nurses out there who are burnt out and wondering if maybe they could build something of their own, what would you tell them?
I would say absolutely 100%. You need to get out of that frame of mind of being a slave to the hospital because they're holding health insurance over your head, that you can't do it. You can do it. I mentor other nurses. It takes a little bit of thought, but you don't have to have everything perfect. And that was my biggest holding back, because it was like I didn't start because I thought, oh, I don't have this done, or I don't have this done, or I don't have this yet. You just have to jump in the deep end and things will figure out. And kind of like with my business, I started off doing IVs, and then people wanted weight loss. So then we added weight loss in, and that was back before, when meds were still okay to be compounded and there wasn't all this legal mire that's going on right now. And then people were asking for more aesthetic things. So then I did some training on Botox, and I got some more training, and we did Botox. And it's just being open to pivoting, being open and receptive to what people's needs are. I actually started another business that stemmed from this, and it was a need that I was seeing. And so my second business that I started, and you didn't even know this, is I do concierge nursing for newborns and new parents. Some of my clients were new parents. They had new babies, and there's not a lot of support out there right now. And when you're in the hospital with a new baby, you're not getting a lot of training, or you don't have family near you to help you. So what I did was I had clients that the moms needed support with breastfeeding. They just didn't know basic baby care, like burping a baby, swaddling a baby, how to basically take care of a baby. Yeah. And in the NICU, we're used to teaching people, teaching families all this information before they go home. So that's when the second company was born out of that. So it's like nurses can do so much. You just need to take your background with what you're familiar with and just help people in a different way.
Yeah. So where can people find you and Hydrate Georgia?
So www.hydrategA.com is my website. I'm also on Instagram at Hydrate GA and Facebook at Hydrate GA, and they can see some of the things that we do here.
Awesome. Yeah. Well, Lisa, thank you so much for walking me through this and how you built it. And to everyone listening, that's another one for the Bridge podcast. We'll see you next time.
Thank you.